Hello everybody, my name is Dr. Stacy Lauderdale-Littin and I'm here today to talk to you about applied behavior analysis and some evidence-based practices that are based on the principles of applied behavior analysis. So ABA is a term that you might hear all the time. You want to get ABA services for your child, you want to get them as soon as possible, and you want to get them continuously for about 1 to 3 years to make sure that your child is making gains. But ABA is not just for early intervention. ABA is for everyone all the time. So I first want to tell you a little bit about what ABA is. Applied behavior analysis is a science. It's an umbrella term for the science that's focused on behaviorism. And it's basically focusing on antecedents, behaviors, and consequences. So as an example, driving in the car, someone sends you a text message. You look down to see who the text message is for. That's the behavior. The antecedent is the text message coming to your phone. The consequence is you ram into the person in front of you. You are then less likely to glance down at your phone because of what happened after that behavior. So that is just an example of how you might use the ABCs, or the antecedent behavior consequence, of applied behavior analysis. Now there are many practices and interventions that fall under the umbrella of applied behavior analysis. Currently there are 27 evidence-based practices that are used for students with autism. And this came out of a paper from the National Professional Development Center. Of those 27 evidence-based practices, there are many that fall under the science of applied behavior analysis. Reinforcement, prompting, antecedent-based interventions, modeling, task analysis, time delay, and discrete trial teaching are some that fall under this umbrella of applied behavior analysis. But what I find is that many people use discrete trial teaching and applied behavior analysis as interchangeable terms, and they're not. Applied behavior analysis is the umbrella, while discrete trial is one of the interventions that fall underneath the umbrella of applied behavior analysis. In discrete trial, you're teaching one discrete behavior, and the way that you might see this done is it might be a teacher sitting on one side of the table and a student sitting on another side of the table, or they might be sitting side by side, but you might see them trying to teach, for example, colors. And they might hold up a color and say, "What color is this?" And the student would say, "Yellow." And then the teacher would say, "Great job," and give them a high five, or sometimes access to a toy or a piece of food or a sticker. And so that is a very systematic way to teach these skills. Some parents don't want their children taught in that way, and that's why they say that they don't like applied behavior analysis, but really they just don't like that specific intervention. So if that happens with your provider, you'd want to just talk to your provider about the intervention that's being used and not move away from the science of ABA, because ABA works for children with autism. The literature suggests that children can make wonderful gains using interventions that are based on this science. In addition to discrete trial, I mentioned some other interventions that are evidence-based. There are a couple of places that you can look to get more information about evidence-based practices. One of them is the National Professional Development Center for Autism Spectrum Disorder, and this is out of UNC Chapel Hill. The other is the IRIS Center, and this is out of Vanderbilt University. Now the IRIS Center has modules that you can work through with videos, and it provides information about not only evidence-based practices, but also the IEP process, parent training, special education law. There are a lot of resources you can find on that website. You can watch the videos, you can download all of the information as a PDF. So this is a great way to learn more about topics that you're really interested in. The other is the National Professional Development Center for Autism Spectrum Disorder. They have modules focusing on all 27 evidence-based practices. In the modules, there are videos, there are fidelity checklists, which means the different steps that you need in order to implement the intervention, and all of this information is also available as a PDF. So that's another great place to look for information that you might be interested in. Another thing they have from the National Professional Development Center is this evidence-based practice matrix. And I really like this because down here vertically, it lists all of the 27 evidence-based practices, and then horizontally, it lists the skills that you can focus on with those evidence-based practices and the ages that these evidence-based practices are most appropriate for. So not every evidence-based practice is appropriate for every child. The evidence-based practice you choose needs to be appropriate for the age of your child and the skill that you're working on. So those are two things that are really important to remember when you're working with your team of ABA providers to determine what interventions are going to be best for your child. All right, this is Kylie. She's a 7th grader at Karis Academy, and she's going to ask some parent questions that came in.
How many hours per week are appropriate?
So for ABA services, you should have about 25 to 40 hours. This is what the research suggests. And it should be for about 1 to 3 years. Early intervention is really important.
What type of things should my child's therapist be focusing on during sessions?
Well, that is a really individualized answer. So your BCBA should be coming in and conducting an assessment with your child, and from that information you determine what skills you want to focus on. It's also really important that the therapist talk to the parents, talk to you, to determine what you want to focus on and what you find most important in terms of social significance to your life. And so based on that, your therapist is going to create some skills, could be focused on communication, social skills, leisure activities, could be focused on many different areas just depending on what the assessment finds and what you find most appropriate.
Am I having a difficult time assessing ABA? Are there things I can be doing in the meantime?
Absolutely. So if you're having a difficult time accessing your ABA services, there are things that can be done in the meantime. One would be working on skills that you deem most appropriate. So one might be, let's say, example, communication. If you want your child to request more, then you can set up opportunities for them to do that throughout the day. So for example, if you want a child to start requesting a cookie, for example, you're going to put those out of reach so the student cannot access those independently. They're going to have to then request the cookie from you. And this might look like reaching for the cookie. And once they do that, you might say, cookie, and then have them repeat that. Or even if they just give a verbal approximation like, "Kuh," then you say, great job saying cookie, and you give them access to that. You might also do this with play skills, have them imitate some of the things that you're doing. Socially appropriate ways to engage with toys. So imitation is a great way in modeling to teach these things. So these are ways that you can start teaching some of the skills that you think are important before you're able to access your ABA services.
Is there an age limit for ABA?
ABA is for everyone, for all ages. It is the science of behavior, and you can use it on anyone from an infant to your husband or your children or your grandmother. So everybody is influenced by the principles of ABA. They impact our daily lives.
What strategies can I use to help generalize the skills that are introduced in ABA outside of the session?
So these are really good questions. I would say one of the best things to do in order to generalize is to make sure that you're looking day to day about in terms of where are these skills taking place and how in the natural environment can I start to ensure that my child is practicing. So for the example with the cookie, on the day-to-day basis, your child might want a cookie. So that's a great way to generalize that skill into the natural environment. They're going to be interested in things, they're going to want to play with things, they're going to want to communicate with people and with peers. And so just taking advantage of those natural occurring opportunities throughout the day is going to really help to generalize those skills that are taking place in a more structured environment.
If you have any more questions for Stacy, please drop them in the comments below the video. Thank you for watching.